Governor, you talk about the anxiety and the fear and the grind of the logistical work that you're doing. I feel like I have a base fear when I think about there being severely ill Americans even by the tens, let alone by the hundreds or the thousands, who need to be hospitalized, who need to be in hospitals, who need intensive care in order to stay alive, not being able to go anywhere to get that care. I mean, I know that we talk about these numbers and these models, and I know lots of states right now are looking at those curves and looking at those projections and seeing how many more beds they're going to need, how many more ICU beds they're going to need. But I don't know how to prepare people for what it might mean when the hospitals are full and what that's going to do in terms of us as a culture and a society seeing that kind of level of human suffering.
Oh, Rachel, God forbid we get there. God forbid this country gets to a point where you see people literally on gurneys in hallways. For this state, I'm not going to accept that. We're doing everything we can to mobilize. We're trying everything. For us, it's going to come down to not the beds. It's going to be staff fatigue, and it is ventilators. You know, almost all of these people now at this point are almost all ICU cases. They all need ventilators, and the ventilator becomes the question of life and death. And we've been talking about these ventilators for a long period of time, and they're impossible to get, any ventilators. So we've come up with an elaborate plan on how to move around ventilators and splitting ventilators and using anesthesia machines and BiPAP machines. And we stopped all elective surgery to free up ventilators. But first, we have to avoid it. Second, I think we have to be smarter. The one silver lining here is not every place in this country gets hit at the same time, right? There's going to be a different curve for the disease in different areas, depending on when it started, and those curves will have a lag. The problem for every area is going to be the apex of the curve, where it just overwhelms the healthcare system. But New York is going to have one apex, Detroit will have another, New Orleans will have another, Texas will have another, Los Angeles will have another. Why don't we devise a national strategy that moves with that rolling apex, if you will? I need roughly 30,000 ventilators, which I can't get. But I only need 30,000 ventilators for 2 or 3 weeks at the top of my curve. I need backup public health professionals, but I only need them for 2 or 3 weeks at the top of my curve. Why don't we have use our national unity and our commonality and say, let's be smart. Let's go help this place. When that town goes over its curve, then we'll go to the next, then we'll go to the next, then we'll go to the next. I think Americans have a lot more commonality and voluntarism than we're using. I asked for national people, public health people to come into New York. We had over 20,000 volunteers in 3 days. 20,000. I have 60,000 volunteers in the state. There's more goodwill and American spirit than we're using, and I think there's a smarter deployment.